Hello, good day, and kumusta? Welcome to this podcast where I am hoping to discuss with you some of the signs and symptoms. Today, I would like to focus on disturbances of consciousness. It is helpful for you to understand the terminologies so that when you start writing these things down in your notes, you will be able to describe it much better. Okay, so consciousness is also considered the state of awareness. Apperception, it's Apperception. Apperception is a perception modified by one's own emotions and thoughts. Okay, so this is a perception that is influenced by their emotion and thoughts. So, for example, when somebody is panicking and all of a sudden things just get numb on part of their body, then that is having apperception because there is an element where their emotion is influencing what they are feeling. Sensorium is the state of cognitive functioning of the special senses. Now, this is sometimes used as a synonym to consciousness. So, sensorium and consciousness are used synonymously with one another. So, when we are going to be talking about disturbances in consciousness, and these are mostly associated with brain pathology. So, when somebody becomes unconscious or there's a disturbance with consciousness, you would typically find this in head injury patients. You would typically find this in critical care, obviously with trauma. As soon as somebody goes into a traumatic experience, physical or emotional on the severe type, levels of consciousness will be impaired. So we're going to talk about some of the signs and symptoms. The first one is a symptom called disorientation. So this is very straightforward. So it means a disturbance of orientation in time, place, and person. What's interesting here is for you to remember orientation. Orient is the east. Disorientation, this is without orientation. So you lost your way. And you lost your way when you lost your orientation to time. You don't know what time it is, the place, and the person as well. So orient is back in the days where people always navigate and they always use east. So this orientation, that's a simple and very common disturbance of consciousness. The next one is called clouding of consciousness. Yeah, so clouding of consciousness, and by definition, it is an incomplete clear-mindedness with disturbance in perception and attributes. This disturbance in perception and attitudes. So let me read that again. Clouding of consciousness is incomplete clear-mindedness with disturbance in perception and attitude. So when somebody is clearly recovering from surgery, they have this clouding of consciousness. So that is the definition for that. Okay. Stupor. Okay. Lack of reaction to and unawareness of the surroundings. So stuporous. So they don't have an awareness of what's happening. Wow, that's really interesting because most of the time people, when you can see them in critical care, they are awake, but they just don't have any awareness of what's happening in the environment. The fourth one is delirium. Okay, so delirium. By definition, delirium is, here a person is bewildered, restless, confused, disorientated, and has a disorientated reaction with association of fear and hallucination. So that is the definition of delirium. Okay. Next one is coma, which means a profound degree of unconsciousness. Okay, so most of the time, people in critical care, they are induced coma, and there is a profound degree of unconsciousness. Then the next thing, once a person, so usually a person who is induced in coma, they are provided with some level of sedation, so a different type of sedation, which we will discuss at some point. The next thing is, after the sedation's been taken off, say for example, clonidine's been taken off, or propofol has been taken off, the next stage is a person would be in a state called coma vigil. Yeah, coma vigil, in which the patient appears to be asleep, but they're ready to be aroused. And this is also known as akinetic mutism. Akinetic mutism. Okay, but if you use the word akinetic mutism in your documentation, that will be, that will get you to get the doctors to scramble to Google and just to find out what that means. But it is technically coma vigil. Okay, twilight state. It's just like a movie, isn't it? So another signs and symptoms, or a disturbance of consciousness, is called twilight state. It's disturbed consciousness with hallucinations. So somebody is on a twilight state. So this is what we would be associated with. We would associate this with this thing called sundowning. Technically, it's true, isn't it? Sundowning, twilight state. Somebody has disturbed consciousness, but there are some hallucinations that's taking place. The eighth one is called the dreamlike state. So this is often used as a synonym for complex partial seizure or psychomotor epilepsy. So somebody is like on a dreamlike state. You see a person, they're awake, they're almost bewildered, but they're nothing. They're like somewhere. They're on a dreamlike state, and it is associated with a partial. A complex partial seizure or psychomotor epilepsy, because this is what they would be like. But again, it's all transferable, isn't it? So dreamlike state is almost like a twilight state, but they're also in the coma vigil state. Okay, and then last is somnolence, which is a person has abnormal drowsiness. Okay, so those are there are 9, just to recap, and I'm just going to read the list very quickly. So the 9 disturbance of consciousness are: number 1, disorientation; number 2, clouding of consciousness; number 3, stupor; number 4, delirium; number 5, coma; number 6, coma vigil; number 7, twilight state; number 8, dreamlike state; and lastly, somnolence. Okay, guys? So those are some of the problems and signs and symptoms that involves consciousness. So that is actually part 1 in the disturbance of consciousness. So we have disturbance of consciousness. The second disturbance of consciousness would be a disturbance of attention. Okay, so attention is the amount of effort exerted in focusing on certain proportions of an experience. The ability to sustain a focus on one activity, or the ability to concentrate. So we've got a few terminologies for disturbances in attention. One is distractibility. Distractibility is the inability to concentrate attention. Okay, so it is an attention drawn to unimportant or irrelevant external stimuli. So that is distractibility. The second problem with disturbance with attention is selective attention. So a person is blocking out only those things that generate anxiety. The third one is hypervigilance. There is an excessive attention and focus on all internal and external stimuli, usually secondary to delusional or paranoid states. And lastly, trance. Here, there is a focused attention and altered consciousness. Usually, this is seen during hypnosis or dissociative disorders and ecstatic religious experiences. Okay, so you have these four things: distractibility. Yes, a person's they cannot attend; they're very distractible. But for example, this is particular with psychological problems and psychosocial dysfunction or psychiatric conditions. If you start talking about selective inattention, is everything is good, everything seems normal, and then all of it, if the person has traumatic experience, say for example with work, all of a sudden they just block these things out. In information, topics, and discussions that involves the stressors are blocked out by the individual. Hypervigilance, this is where everything, the person just feels everything uh, around or internal, both external and internal. So it's like, oh, what's wrong with my knee? I can feel something, it's throbbing, or I can hear voices out there. Is everything okay? So there's really hypervigilance. Everything. That's hypervigilance is one form of distractibility, isn't it? But you're just describing distractibility. Okay, and trance is trance. You've even got music for that. Okay, the last section on the disturbance of consciousness is called a disturbance in suggestibility. Here, compliant and uncritical response to an idea or influence. So whether a person is suggestible or not. So there's two terminologies. You have folie à deux or folie à trois. Okay, so it's communicated emotional illness between two or three persons. Folie à deux. Now that's why people are saying that people living together is it's quite infectious to have mental problems sometimes, and this was the theory behind it, because when a person lives with one another, you get to associate some of the behaviors and beliefs of the other individual, and then all of a sudden you would have similar symptoms. So it's very suggestible. There's two people on that side. Then the second one in terms of disturbance in suggestibility is hypnosis. So this is artificially induced modification of consciousness characterized by a heightened suggestibility. So hypnosis. Okay. So just a recap, guys. So disturbance of consciousness or the state of awareness, you have three main areas to look out for. One is the actual disturbance of consciousness, in which there are 9 problems, like the somnolence, the dreamlike state, coma vigil, the delirium. You also can describe the second one is the disturbance or in terms of attention, which would be distractibility, selective inattention. You can have hypervigilance, and then the trance. And then lastly, you can have a disturbance in suggestibility. Now, in our practice, because it's not a mental health, then disturbance of suggestibility has very little influence on what we're doing. But most of the time, we would come across with the disturbances of consciousness and disturbance of attention. I really just think that it is very helpful for a clinician to understand these symptoms, because when you understand the symptoms, you're able to treat it much better. Thank you, guys. I hope you learned a little bit from this short discussion. Until next time, bye.